self-advocacy is essentially, consumers feeling empowered enough to be able to speak to their own concerns and speak about their health conditions. Sounds like an easy enough phrase, but it's actually very hard to do.
I think of healthcare as a partnership, and at the centre of that is the consumer's experience and their capacity to self-determine what they need.
You've got the right to ask as many questions as you like about what's going to happen, how much it's going to cost. And you've also got the right to tell them why you're really, really scared and how they can help you.
I see advocacy within the space as a team effort between the person who is living with a condition and the medical system that supports them.
I became a health advocate because I have a chronic illness, and my initial diagnosis didn't go so well. I didn't feel like I had the right information.
I became an advocate because of an experience I had in the 70s in London. I had a baby, and the baby wasn't well. I was too young and naive to push for them to investigate further or to say, no, look, there's something wrong here.
One day I went to a party and I fell in love across a room. And the person that I fell in love with told me they were living with cystic fibrosis. I wanted to love and have a life with him, but I also wanted to ensure that he and other people like him could have a long life with the people that they love too.
I became an advocate because I want to learn as much information as I can about the diseases I have. I have 9 chronic diseases.
There's all sorts of stigma that you see when you're in healthcare, which is about, that person's poor, that person's, fat, that person's whatever, as a smoker. And people had their healthcare options limited by some of those things, and I thought that was wrong.
Self-advocacy is important because it gives people control over what's going on with them, and that feeling of control can build confidence.
I think without users speaking up, users and carers speaking up, quality and safety suffers.
Healthcare professionals need to understand that how I feel or how I should be included in things.
We know that medical professionals go through an enormous amount of education to be in the roles that they're in, but there is nobody who knows the consumer more than themselves, and there's nobody who sees their differences and their changes and their strengths and their challenges more than the person who cares for them.
I think part of my capacity to self-advocate for myself was sitting down with my doctor and being able to really clearly articulate my needs and to say, I think I need something different. What are the options?
I guess a very significant time when I advocated for my now deceased husband. He was on oxygen 24/7, and we discovered that the allocation of oxygen was 2 cylinders a month, which is sort of enough to take you out to 2 doctor's appointments perhaps, but doesn't allow you the flexibility, let's call it, or the right to live the life that you want, because breathing is essential. So I took my husband in his wheelchair with his oxygen to see the bureaucrats to look for greater support of provision of oxygen, and we got it.
This happened one afternoon when I was at the hairdresser's. She said the night before she'd taken her little baby boy to the emergency department. She felt they saw her as a paranoid mum, and she was trying so hard to advocate for her little boy. He had extremely rare respiratory paediatric problems. He was under the only respiratory paediatric specialist in Australia. What I suggested to her was that she go back to that specialist and ask him to write a plan for every time she went to the doctors or went to the emergency department. And since then she's told me she's never had problems.
I do it each time I have to change doctors. I interview them when I go to see them, and most of the time you can tell really quickly if you're going to be able to work with them or not. I think that's something that's been really important to me, because I don't feel worried about going to see the doctor anymore, whereas I spent years and years thinking, I won't go to the doctor about this or that.
Be confident that you have expertise. Sometimes I've felt I don't know what's going on. I am worried about something and I've not said something. I've not raised the concern because I thought, you're being a bit silly. These thoughts have gone through my head like, the doctor knows, or the person who's making those decisions know. But when I've actually raised the concern, it has actually alerted something that might not have been realised.
The most important thing is looking at consumers as partners. So rather than doing things to them or making decisions for them, actually ensuring that they understand absolutely what it is that's going to happen and that they've actually given you consent and are participating in it.
If you're working in the health space, recognising and listening to a person's lived experience is the most powerful thing that you can do.
I think also they need to prompt people to ask questions, not just assume that people will ask if they don't understand. A lot of people will not ask. So if they prompt them and say, do you understand what's happening? Are you comfortable? An attitude like that I think will go a long way.
All of the research I did for my thesis, my PhD, on the doctor identity showed that if a doctor has a really serious illness, it changes the whole way they deliver medicine. And I think you don't want everyone to have that. But if you can actually get them to see it in a personal way and to understand the vulnerabilities that people feel and their role as a safekeeper of that person.
My tips for people are: 1, take a deep breath.
Spend some time thinking about what your personal goals are, what you want for your life and for your health.
A list of questions, a list of your symptoms, and a statement as to what sort of outcome you're chasing, I think is very helpful.
It's okay to say, please explain, to ask dumb questions.
I know that it can feel like we're going up against these systems and we can feel quite powerless and quite intimidated. But what I would say is that you are the most important factor in navigating your care.
Start from the premise that you or your loved one or the person are in the best position to know what the issues are with your health.
Don't give up straight away, because it might take a few times for you to get what you need.
Do your research, do your best to understand your condition, connect with a consumer organisation and other consumers who may have had a similar experience. Not to frighten yourself, but just to be aware of, what are the potential pathways that you may be sent down.
Understand that you're worthy, and it doesn't matter how sick you are, that you should have a voice. And really to be quite firm about your right to be treated as appropriately as a human being and with kindness.